Right now we're entering the peak months for several respiratory viruses, and it's more than just the flu to watch out for.
And this morning, our 9 Health expert, Dr. Pyle Coley, is with us to shed some more light on what's being called the tripledemic. So we've heard of the twindemic. This is the tripledemic. What is this?
Yeah, you know, we worried for the last couple of years about the twindemic, the COVID and the flu viruses coming together. And this year it's actually a reality. So already here in October, before the end of October, we're now seeing a surge of COVID, flu, and RSV, respiratory syncytial virus, occurring all at the same time, with many hospitals across the country already hitting capacity before the winters even really started.
Do you think that's because our immune system hasn't been worked out? We had the social distancing, we had the masks, and this is all kind of coming from that?
Yes, I think that's exactly the reason. In fact, for the last 2 years, there are more susceptible hosts now present because everyone who might have gotten milder infections the last couple of years really didn't get anything at all. We also think, and we don't know this yet, we're studying it really, that the virus can change. Because by masking and changing our behavior, we're putting evolutionary pressure on the virus to evolve, to become different. And what we're seeing this year for the first time ever is a peak occurring in October for RSV when it really should be occurring in the late winter.
Talk a little bit about RSV. It's the less well-known of those viruses, I guess.
It is. It's been around for a while. Parents are familiar with it. It causes mostly cold-like symptoms, and young kids cannot necessarily have a fever. And the ones that are the most susceptible to ending up in the hospital, Gary and I were just talking about your son, are the little kids and the older adults, pregnant women, and immunocompromised people. And it lasts about a week, but it can last for up to 2 weeks. But that cough that you get with it can last actually for several weeks after.
So
and some kids, I'm sorry to interrupt, some kids really get it bad. They end up on ventilators,
They really get it bad. It gets into their lungs. It causes what's called lower respiratory tract symptoms, not just upper. So not just neck and up, but actually gets into the lungs. So we see kids grunting and wheezing and really struggling to breathe, and many of them end up in the hospital. Many more actually end up on ventilators, and for most of the illness. There's not many treatments for it, unfortunately, so we just sort of have to wait it out. There's not an antiviral or anything we can give.
That's what I was going to kind of ask. I think you alluded to it, but for like any parents at home, what are like the main symptoms where you know it's something a little bit more serious, you probably should go to a doctor and get it checked out?
So I think really watching how they breathe, watching how they eat, and watching how they behave. So if they're breathing what we call accessory muscles, using their neck or using their belly, you really see that chest moving. You shouldn't be seeing a lot of grunting. You shouldn't be seeing their nostrils flaring. Any of that is happening, or you hear audible wheezing. Those are all signs that they're struggling to get oxygen. If you have an oxygen probe, you should, stick it on their finger and check. If they're not eating, they're at high risk for dehydration with RSV. That's big, especially in the little ones. So it's really important to monitor the urine output, how many diapers you're changing every few hours. They may not always have a fever. And if they're very lethargic, they're not playing as usual, that's another concerning sign.
We've been talking about how people should get vaccinated, get their flu vaccination and their COVID vaccination, but there is no vaccination for RSV, right?
There isn't yet, but I am very hopeful, Gary and Corey, that when we have this conversation next year, we may have a triple vaccine heading into the winter season, because a lot of companies, including Moderna and others, are actually working on designing the first ever RSV vaccine, because we've had it around for so long, and we know that it's such a thing that we struggle with every single season.
All right, Dr. Coley, thank you so much for coming in.
Appreciate it.
Really appreciate it.
Good to see you.